That's another really interesting thing. So using myself as an example, I'm very happy to be a 15-year survivor, and that kind of is the greatest, the greatest benefit of all. I participated in the Herceptin clinical trial. I knew all the risks that came with me being on that trial, but there was also side effects. So, for example, now that I'm also aging, which is a good thing, I'm happy to be aging. There's just other issues that happen to you when you get older. So now when you're a cancer survivor on top of aging, these are challenges for not only the oncologist, but for the primary care physicians as well. I think the care coordination among different physicians. So even though I'm a 15-year survivor, I know one of my personal challenges that impacts other survivors as well is knowing, okay, your knee's bothering you. That's clearly not an oncology issue, but is it? Do you have, bone cancer? So I think the care coordination between the physicians is really critical, because most cancer survivors see a variety of physicians. So I've given an example when I've done presentations across the country. I've had over 15 different specialists taking care of me since the time I was diagnosed, from cardiologists to endocrinologists to my oncologists to surgeons. So I think having the coordination can put the survivor's mind at ease, because you know that your doctors are communicating with each other and that you're not getting conflicting guidelines on what you should do about your particular situation with aging. Or your question is always, is this an aging issue? Is it memory lapse because you're aging? Or is it chemo brain? And can you really have chemo brain 15 years later? Some people will say yes. So it's an interesting concept.